Hello and welcome to the launch of the National Safety and Quality Mental Health Standards for Community Managed Organisations on behalf of the Australian Commission on Safety and Quality in Healthcare. My name is David McGrath and I'm the Executive Lead on Mental Health Standards for the Commission. And I'll be your host for today's launch. I'm looking forward to introducing you to the standards, and throughout this event I'll be joined by experts with experience in the mental health field to assist in providing a comprehensive perspective of the new standards. But first, I'd like to acknowledge the traditional owners of the lands on which we are meeting today, and for me, that is the Gadigal people of the Eora Nation, and to pay my respects to elders past, present and emerging. I would also like to acknowledge those of you who are listening with a lived experience of mental ill health, those who are joining us today, and to recognise your significant contribution to better policy, programs and outcomes in the mental health field in this country. Today we are launching the National Safety and Quality Mental Health Standards for Community Managed Organisations. The NSQMH CMO standards were developed over a period of 18 months with significant consultation with service providers, people with a lived experience of mental ill health and their families, peak bodies and regulators. The standards were subject to two separate public consultation processes, both in advance of their drafting and after a first draft was constructed. It's expected that after today's launch, services can familiarise themselves with the standards in preparation for the NSQMH CMO standards to be available for accreditation processes in early 2024. Joining me today for the launch is Carmel Tebbutt, CEO of the New South Wales Mental Health Coordinating Council. Welcome, Carmel. I'm really pleased you could join us today.
Thanks, David, and it's great to be here.
Now, first, could you tell us a little bit about what the Council does?
So the Mental Health Coordinating Council is the peak body for community managed organisations in New South Wales. So we develop policy on behalf of our members, undertake advocacy. We're a registered training organisation delivering both vet and professional development training. And there's similar organisations across Australia in other states and territories.
So these standards are really important for your membership then?
Absolutely. Community managed organisations are involved in mental health service delivery. These standards have been specifically developed for mental health service delivery undertaken by CMOs, so very relevant to our members.
Now, I imagine there are a few people out there who'd be interested to know what a community managed organisation is. Are you able to tell us a little bit about what a community organisation is and what it does?
So community managed organisations are non-government organisations, often not-for-profit, but not always. They're working in the community to deliver mental health services. They range in size. It's a very diverse sector. So CMOs can be anything from a very large national organisation employing thousands of employees, delivering services right across the human services network or kind of span of services, to a small organisation that might be just operating in one community with one service with a lot of volunteers. So it's a very diverse sector. They deliver services such as accommodation support, employment support, helping people connect in their communities, psychosocial rehabilitation, step up, step down services, peer support, and also counselling and helplines. So an array of services in the community, helping people, supporting people with lived experience of mental health conditions to live well in the communities of their choice.
So these standards are going to be very important for those community managed organisations to be able to assure themselves around the safety and quality of the services that they provide.
The standards are new, so there will take a period of time for organisations to get used to working with them, but many organisations are already accredited through other processes, and so I think the difference that these standards make is that they've been very specifically developed for our sector.
Indeed, they've been purpose designed for community managed organisations, which is unusual and unique for this particular set of standards.
Absolutely, and the consultation process has been welcomed by community managed organisations. They've had an opportunity to have input into the standards, and I think that means the end product is a very good product and something that the sector can embrace.
That's great. Thank you, Carmel. Look, briefly, many people wouldn't be familiar with the standards, and it's probably useful at this point to talk a little bit about what's contained within the standards. So as Carmel said, CMOs are a key part of the service system with multiple points of contact with consumers, carers and their service providers. This makes safety and quality service standards crucial to ensuring consumers and carers can be confident in the care that they receive. Now, the standards will be new to most people joining today. Briefly, the NSQMH CMO standards contain 3 standards: practice governance, partnering with consumers, families and carers, and the model of care standard. Each of these standards contains actions that services are required to address in order to be considered compliant with the standards. Across all the standards, there are 82 actions covering the range of activity involved in operating a community-managed mental health service. This breadth of coverage provides confidence to consumers and carers in the care they receive from an organisation accredited to the standards. So let's hear from someone with a lived experience of mental ill health and a user of mental health services about how the standards can improve services.
My name is George Yap and I'm 63 and I came from Malaysia and I've been in Australia since 1988. Flourish is one of the best things that happened to me. It started I think 4 or 5 years ago. Before then I didn't have any service and I was kind of lost, no format of quality of mental health. And so I joined Flourish in 2017, I think, and since then it has been very good. For daily, like Thursday and Sunday service, we go for coffee, we go for shopping, which I needed for transport to carry my shopping, and they take me out for coffee and shopping. And then I combine the Thursday and Sunday 2 days together into 1 day, going to visit like Bondi Beach. We go for a swim. So at the end of this month, we are going to Bondi Beach for a swim. So 2 days combined to 1 day visit. Last time I was in Blue Mountain. And one of the things with Flourish is like decluttering my house. That was the best moment because I rang up my Flourish support coordinator, Melissa, and she organized someone to come into my house. It took about 4 visits and decluttering the entire house, all my research work, all my books and that, they all entirely take it out of the house. And ever since, I just want to stay in my house and never want to leave the house. Australia is a very isolated country, and I don't have many friends. So isolation and loneliness is one of the mental illness. And I think loneliness can be so with Flourish, it's a standard service where I can have conversation. So over the coffee, just talk about every subject that you can come up with. And so, I mean, the loneliness with a standard visit, Thursday and Sunday, I can have someone to confide with, you know, and someone to go out and be part of the community. I'm grateful to Flourish. That's the best thing that happened to me, Flourish, you know. And now I'm on my recovery journey until the eternity.
So listening to those thoughts, Carmel, it underlines how important the Partnering with Consumers standard actually is.
Making sure that the needs and aspirations of people who are using the services is right at the centre of what services are doing is really paramount. And that standard, the Partnering with Consumer standard, really does recognise that. Of course, community managed organisations have worked in this way for a very long time. In fact, CMOs have championed partnering with consumers, focusing on co-design, making sure that consumers really are at the centre of what they do. So it's really welcoming to see those requirements very explicitly recognised in this standard.
So it's a lot more than just asking consumers what they want then, isn't it?
It's about making sure that consumers are involved in every stage, whether it be planning, service delivery, evaluation. Really, co-design should be at the centre of what services are doing.
Yes, I agree. And the standards really do reflect that, because the standards require involvement of consumers in organisational governance, evaluation and monitoring, workforce training, as well as being partners in the delivery of their care. It allows for advanced care plans and looking at the holistic needs of the consumer in terms of how the services are designed and the partnerships that services arrange with other organisations. So that means the standards will definitely be angled towards true partnership with consumers.
Yes, I think that's right. And you've hit the nail on the head, really. It is about making sure that consumers are involved in terms of the overall development and delivery of services, but that they're also drivers of their own recovery journey. And I think the standards get that balance right very well. It's good to see that there's a focus on supported decision making, effective communication, but also partnering with consumers in terms of design, delivery and implementation of services.
But these are not new concepts for your organisations though, are they? I mean, your organisations have a long commitment to partnering with consumers in the delivery of care.
The CMO sector have really championed this over many, many years, working closely with consumers and consumer organisations and carers as well, families and carers. But I think what the standards really provide is a very clear articulation of those concepts and really set a benchmark that service providers can take on board. And I think that's a positive development.
Yeah, well, thank you for that, Carmel. I think now it's probably useful to hear from a worker in the mental health space about the impact of standards on service delivery inside an organisation. We've asked a peer worker from the Flourish organisation, Chris, to talk to us a little bit about the impact of standards on his day-to-day practice.
My name's Chris Crumley. I'm a peer worker at Flourish Australia. I've been doing peer work for about 9 years, and I currently work as the specialist peer worker at Flourish Australia. As a peer worker, I'm able to purposely and meaningfully use my lived experience throughout my work to be able to support people that I'm working alongside. In my current role, I'm able to then pass on that knowledge through various training and professional supervision and things like that. And I feel it really allows me to recontextualize and reframe experiences in my life that were, not great experiences to go through, but really to be able to create new meaning to those experiences, to be able to support people through their own recovery journeys. Well, I always call myself a bit of a peer work geek. I like the sort of practice around it, and that kind of pushed me more towards the realms of development and mentoring and supervision and things like that. So that kind of led me into the role that I'm doing now. So I think I've always just really liked connecting with people and being able to have those really human interactions with people. I think it's quite unique in the fact that we're not bringing just our professional selves into our work, but we're also bringing a part of ourselves into our everyday interactions with people that can leave you quite vulnerable, but also is so powerful in connecting with people. So I think a really good thing to be mindful of is where are you in the stage of being able to reflect on those experiences that you've had, and are you ready to be able to use them in your work meaningfully and purposefully? And really that ability to practice that self-care and be aware of your own well-being and things like that. There's a big difference between being a peer worker and being a support worker that has a lived experience. There's a professionalized kind of component to that in knowing the skills and practices and core values that determine how we work with people. It is a practice unto itself. It would be quite comforting knowing that, that organizations are, having to sort of fit certain standards and things like that. So I'd have confidence in knowing that my organization is covering all the bases that it needs to. I know that my own self is held accountable to the work that I'm doing, and also because it's all about the people that we're supporting. So I think knowing that the organization, other organizations, my own practice, other people's practice, having the confidence to know that we have a set of standards to be able to govern that and to be able to be held accountable to, I think that holds me with a lot of confidence. I think one of the common sort of feedback that we get from people within the industry, and especially people with lived experience, is that we are utilizing a lot of set of standards or governance that are quite outdated, that have been put together without collaboration of people with lived experience and also carers, partners and families. So I think that having these standards come in, knowing what the current climate looks like, knowing what best practices can look like, and having that involvement from people with lived experience and others, I think that's a really good, a good set of things to have now, to be able to know that, okay, these are fresh, these are updated, these are inclusive. Every major building block that kind of gets put into place like this is a huge step forward, because it's something we can leap off.
So Chris's thoughts highlight the importance for workers of a set of standards that provide a framework for safety and quality inside organisations. Carmel, the peer workforce in particular is a growth and important part of the community managed sector.
I think that's one of the most positive developments we've seen over probably the last 10 years in mental health service delivery, and that is the growth of the peer workforce, people who use their own lived experience, their own recovery journey to work with others. The feedback in terms of the difference that peer workers make to people who are using services is very, very positive.
So the recognition of peer workers as a core part of the workforce, which the standards do, is an important step forward.
Yes, I think that's right. And it goes back to that issue of having standards that are purpose-built for the community managed organisation sector and mental health service delivery does mean that you can incorporate things like that really are a very important feature of service delivery in mental health.
Your organisation's been doing training of peer workers for a considerable time, so clearly you recognise the importance of building that workforce into the operation of services to ensure that consumers are having their rights recognised and that the recovery journeys are appropriately moved forward.
Yeah, that's right. MHCC has been delivering the Certificate for Mental Health Peer Work course for many years now. We're involved in the establishment of that course. But what we've seen over the last couple of years is a huge increase in the number of people wanting to undertake the training. And I think that reflects the demand, both in the community sector but also in the public mental health service system, to employ peer workers because the value they add, the difference they make is very, very visible.
But it's not just consumers, carers and peer workers that are interested in the standards.
No. Mental health service delivery is complex. Service providers are always looking for ways to develop and deliver a better quality service to improve what they do. And of course, funders want to make sure that they're getting value for money. So funders are also very interested in the standards.
Well, that's a good opportunity, Carmel, to hear from a funding body about the impact of the standards on funding and contracting arrangements with community managed organisations. Let's hear from Jill Yearsley, who's the CEO of the Northern Territory Primary Health Network, about the impact of these standards on her relationships with community managed organisations and on the impact on funding and commissioning. Let's hear from Jill.
So my name's Gillian Yearsley, and I'm the CEO of the Northern Territory Primary Health Network. The primary health networks, there are 31 of us in the country. We cover all states and territories. See, we work with local communities and we work with them to determine what service requirements they have in specific areas. That's mental health, primary health such as GPs, pharmacy, it could be digital health, it could be aged care requirements, it could be early intervention for young people and families. There's a whole range of priorities which would fit into that cohort. So health isn't just about hospitals and doctors, if that makes sense. It's about a much wider network. The standards provide a blueprint for the community managed organisations to develop their quality improvement strategies around how they deliver services. All services want to do the right thing and want to deliver high quality services, but it's difficult for them to have a consistent benchmark from how to measure themselves. So there's a really strong commitment from the government in order to ensure that the consumer voice and the lived experience voice is centric to the service provision models that are being requested of community managed organisations. And whilst at the moment community managed organisations will report upon that, there's no standardised methodology about how that's collated or reviewed or analysed to provide some consistent data. So there'll be some clear standards attached to the expectations around that, and there'll be just demonstrable outcomes associated which service providers will need to undertake. It was important for us to share our thoughts about what we thought was important for the sector to be able to report upon and the standards they needed to achieve, because we often are the recipients of feedback from the community about what's not working and why, or what's missing and why. I'm really passionate about the quality that services can deliver and do deliver. And the ability now for them to demonstrate that in a way that is specifically developed and designed for them to do so. Historically, community managed organisations have had to adapt and retrofit standards developed for other service models in order to demonstrate their value. And that's not been it's been a difficult journey for them to undertake, I think. I think this really begins to show and provide the understanding to the rest of the sector around the value that the CMOs provide, and also clearly articulates the standards at which we hold them and which they achieve. So that's a really good thing for us. It is a massive win all round. I think people will, of course, any change is problematic, and the change management process will need to be managed in a sensitive and supportive way. But from what I understand and what I've seen so far of the way that the team wish to do that, I believe that that will be the case. And we will be on board as PHNs and as the sector to support the implementation strategy too. So I'm hopeful that this will provide good outcomes for everybody.
So, Carmel, the funding arrangement is in many ways a partnership between the funder and the service provider to get better outcomes for the community, isn't it?
Yes, that's right, David.
And the standards will help with that because it provides certainty for service providers around the reference point for safety and quality in their organisations.
I think so. Certainly the fact that standards have been developed specifically for the community managed sector is very much a recognition of the important role that the sector plays in mental health service delivery, and the standards provide a reference point around safety and quality that both funders and service providers can really meet together on. So yes, I believe they will make a difference. I mean, the funding environment, as you know, is very complex. CMOs are often operating with funding from different levels of government, state, federal, from primary health networks. So having something that all parties can agree upon, I think is a good development.
And addressing that complexity is going to be very important for service providers. The complexity of those funding arrangements and the complexity of often the standards that they need to be accredited to. So ensuring that these standards operate across multiple settings is going to be important as well.
Yes, I believe so. I mean, of course, the standards aren't mandatory, but we know that funding bodies may well require compliance with the standards. So I think having that consistency is something that is useful in that regard.
Indeed, and the fact that they're not mandatory is important, and also that there'll be time for organisations to become acclimatised to the standards and to understand and assess themselves against the standards well and truly before the accreditation process begins in 2024.
That's right. The sector have been very clear that they do need time to adjust to these standards. I mean, many organisations, particularly the larger service providers, are already operating under multiple sets of standards, whether it be aged care standards or the NDIS practice standards. But these standards are new, and it will take time for the sector to adjust to them. So we welcome that period of time, and also that there will be resources and support to assist organisations to understand how they can demonstrate that they meet the standards. Of course, we know that not every standard is going to be applicable to every organisation.
Absolutely.
It will depend to a certain extent on what the service provider is delivering, the complexity of the services. But as I understand it, there's also the flexibility in the accreditation process to recognise that.
Absolutely. There'll be opportunities for organisations to indicate that a potential set of actions may not apply to their organisation. The standards will be aligned to the complexity of a given organisation. And you mentioned the resources earlier. They will be very important in order for organisations to be able to understand best practiced examples that they can use to meet the actions in the standards. And the Commission understands that those resources are necessary to be able to take safety and quality forward in organisations in the way that we'd like.
Yes, and we certainly would hope and believe that the Commission will work with CMOs around developing those supports and resources for organisations so that they can really understand how best they can demonstrate that they meet the standards. It's been a collaborative process to date, and I'm sure that will continue.
Yeah, and the Commission's very grateful for the contribution of service providers in the development of the standards. The consultation processes, our advisory processes, service providers have been central to what we've done in developing the standards, and we're very grateful for that assistance.
Yes, and I think service providers have a great interest in and a commitment to making sure that the standards are as relevant and as good as they can be for the sector in which they're operating to.
I acknowledge that's absolutely true, and we also acknowledge that service providers have been involved in accreditation for a considerable period of time and have considerable experience with standards.
Yes, that's right. And of course, we will continue to advocate to get mutual recognition across the various sets of standards that now operate within the mental health and disability space. But that's a longer term project. I mean, we want to make sure that the compliance burden for organisations is not significant. But there's no doubt having standards that have been developed very specifically for our sector, that have consulted the sector, that have provided the opportunity for the voice of the sector to be heard, I think take the whole process in the right direction.
So service providers are your members, Carmel, and these standards are very important to them, and their views will be important to how the standards are rolled out. Is it important that the standards are fit for purpose and that the characteristics of the standards are directly relatable for those organisations?
Yes, I think it is. Having standards that are fit for purpose means that the unique culture and history of the community managed sector can be reflected in the way the standards are constructed, and I think these standards do achieve that. Certainly there was a lot of consultation, there was input of the sector into the development of the standards, and I think we see that in the final product. For example, the section on values in the standards recognises the importance of recovery-oriented practice and trauma-informed care for the community managed sector. So yes, I think fit for purpose or developed specifically for the sector has made a difference in the relevance of the standards.
And you outlined earlier on in our conversation the breadth of what CMOs do. Do you think the standards are broad enough to cover the range of service provision for the CMO sector?
Yes, I think they are. As we've talked about, the CMO sector is very diverse. You've got very large organisations with sophisticated operations. You've got small organisations that might be operating with a very small staff. But the way the standards are constructed, I think the line of sight between the sort of purpose, the intentions, the criteria make it easy for organisations to see how they fit into that. And of course, again, as we've discussed, there's a recognition that not every standard or every aspect of every standard will apply to every organisation. And so there's flexibility. They're comprehensive, but I think they're also flexible enough that organisations can work within the structure.
Absolutely. Well, that's good to hear. And CMOs are obviously expanding their service provision all the time and moving into new fields. And one of the strengths of the Commission being involved in the oversight of these standards is the Commission evaluates and monitors the performance of standards over time and can make adjustments to the standards as needs be, as the Commission has overall responsibility for the standards going forward. And that's a strength, I think, for the CMO sector, to know that the standards won't be just a point in time. As we get more data and we observe how the CMO sector changes, the Commission has the opportunity to improve the standards themselves as we progress.
Yes, I think, again, that's important. I mean, the standards really do need to be a living document, not something that captures service delivery at a point in time. Indeed. And the process that you've outlined allows for that. I mean, you know, if we want the standards to remain relevant to the people who are delivering services, to the people who are using services, to carers, to families, then we have to make sure that they can move and change over time. I mean, that's the best way of really seeing the standards inspire the sort of quality improvements that we want and we all want to see happen.
Absolutely. Well, we're looking forward to the sector's involvement with the standards rollout, and we're very pleased that the sector have contributed to the development of the standards to date.
And I think the sector's valued the opportunity to have input.
Thank you for participating in the launch of the National Safety and Quality Mental Health Standards for Community Managed Organisations. We are very pleased to launch them today. With these new standards, alongside the new National Safety and Quality Digital Mental Health Standards and the user guide for the National Safety and Quality Health Service Standards for Specialised Acute and Community Mental Health Services, it provides full coverage for the mental health field in Australia. But I'm sure there'll be tremendous interest in the next steps. The Commission has begun work on adding the new standards to the existing national accreditation scheme and has begun development of resources to assist organisations to prepare for accreditation against the standards. We expect that the scheme arrangements and resources will be ready by the middle of next year, and scheme activation is expected by early 2024 for services to become accredited to the new National Safety and Quality Mental Health Standards for Community Managed Organisations. We encourage you to read the standards, begin familiarising yourself with them, and begin preparing for assessment against the standards. If you wish to be involved in the development of supporting resources, please contact the Commission at mentalhealth@safetyandquality.gov.au. Thank you, Carmel, for participating in the launch today. We're very grateful that you've joined us.
Thank you, David. It's been good to be a part of the launch, and we'll watch the next steps with interest. Very much looking forward to it.
Absolutely. And thank you all for joining us today for the launch of the National Safety and Quality Mental Health Standards for Community Managed Organisations. We hope that will help all of us to understand the outcomes that are most important for consumers. Thank you again, and goodbye.